I now have the pleasure of introducing our keynote speaker for this convocation. Every year we choose a keynote speaker who we think truly has lived a life that embodies think, teach, do, and who we think will be memorable for our graduates. And this year, we really are very excited about Dr. Karen Desalvo. Dr. Desalvo is the former Acting Assistant Secretary for Health in the US Department of Health and Human Services. In her role at HHS, which went from 2014 to 2016, she oversaw the Office of the Surgeon General, 12 core public health offices, and 10 regional health offices across the country. During that period, she also filled the role of the National Coordinator for Health Information Technology at HHS. In that capacity, she set national strategy and policy on health IT, working to shift focus from electronic health records to standardized data by developing an interoperable health IT system for the country. Before her time at HHS, she was Health Commissioner of New Orleans, where she revitalized the city's largely out-of-date health department. After Hurricane Katrina, she worked to build an award-winning model of neighborhood-based community health services for vulnerable populations. Dr. Desalvo is a member of the National Academy of Medicine and has received the Surgeon General's Medallion, which is the highest award we give in this country for public health service. On a personal note, I have had the great privilege of serving alongside Dr. Desalvo in a number of committees, and I have always been struck by her common sense, decency, and genuine commitment to the health of the public, probably the highest praise I can give. I very much look forward to hearing what she has to say today. Graduates and guests, it is my distinct honor to call on Karen Desalvo to give the keynote speech of this year's convocation.
Well, good morning. How y'all feeling? Good, it's wonderful to be in Boston. Thank you for that generous introduction, Sandro. You are one of my public health heroes, honestly, and so I was so honored to be invited by him and by the faculty and staff and students to share with you in this incredible day and be a part of your ceremony. You all are quite lucky to have him at the helm and as he shepherds you all into the future. Graduates, congratulations. How you feeling? You look pretty great. Today is really about you, as it should be, because I know you have worked so hard to get here and your world is just beginning to take off. But I do want to take a moment to say that though it's about you, we should remember that it's also about the people who have helped you, who have hoped, who have fought for you along the way, your loved ones, your colleagues, your family and friends, people that are making sure that you're walking across the stage and off into your exciting future. All of us are carried by community at different times in our lives. And it's so important that we remember to say thank you and also that we remember to pay it forward. So let me begin here. Man, did you all make a great decision to come to the BU School of Public Health. And I really mean that most sincerely. I got a great education when I was a public health student about 4,000 years ago. But not one like you all have been experiencing here under the guidance of Dr. Galea and the faculty and staff here at the school. It's a really extraordinary curriculum where you all are reinventing the future of public health. You are learning to train and create the public health leaders for the work that we all must do tomorrow. And you have been able to also take research and innovation out of the walls of academia and really apply them into the field. You all are living think, teach, do. It took me years personally to understand some of the foundational pillars of your curriculum. They are ideas that I didn't actually learn in a classroom, but on the streets of New Orleans. It was in 2005, and I was a member of the faculty of the Tulane Schools of Medicine and Public Health in New Orleans. I was passionate about healthcare and education, about research and public policy, and I was doing good work that I was proud of. And then Hurricane Katrina came and knocked all of us to our knees, and everything changed. Like all catastrophe, words will really never quite convey the truth or pain of what we experienced, and it certainly was devastation and carnage for many. There were lives lost, futures broken in two. But on a day in early September, just about 2 weeks after the storm, I found myself standing on a ramp to what had previously been Charity Hospital, and I looked around and saw something amazing. I saw people from organizations like United Way and Catholic Charities, people I would not normally have interacted with in my academic life, who were coming together with one purpose in mind. Yes, to rebuild, but more importantly, to reimagine and reinvent a city that had been plagued by poverty, by poor health, and by inequity long before our levees broke. At the time, I didn't have a formal title or authority to lead in public health, but I had a mission, and I learned that others shared that mission, that we should give this community not the health system they had that led to those poor outcomes, but really one that they deserved, one that would eliminate disparities and create a community where the healthy choice was the easy choice. I learned then the power of partnership. On its own, Tulane sure had resources, we had ideas, we had research, we had faculty, but our work manifesting in things like white papers and manuscripts would not really be the kind of change that was needed to create the community we wanted to after a catastrophe like Katrina. And so after the waters receded, we saw we had power to do more together. We should bring the strengths of academics, of the faith-based community, medicine, social services, business, and of course, public health to the table. Our early work was to meet the urgent needs of our community at places like makeshift care stations, but we set about to really move upstream and create a health care system that was not about a hospital-based one we'd had before, but one that was focused on community health. Over the next few years, I saw time and time again that the truth that you all know, which is that health is more than healthcare, because though we gave the New Orleans residents a healthcare system that was the best we could build, and the clinical care was and is working to improve health, it only affects 20% of their overall health. We were falling behind on the other 80%. When our patients left us in the clinical environment, they went often to neighborhoods that were unsafe, to houses that were contaminated with mold. Their jobs didn't pay them a living wage. Their bus system didn't show up in their neighborhood, or if it did, it caused them to be late for work. They wanted to eat healthy, to follow their diabetes diet, but they didn't have access to healthy, affordable food in their neighborhoods. It was the accumulation of these many moments with my patients and with our experiences in community in which I realized that I wanted to move into public health, to do more, to become the city's health commissioner, so that I could help build the kind of infrastructure that could serve people's needs outside of the healthcare system. I internalized your motto for myself: think, teach, do. There was much to do in New Orleans then, just like there still is to do in this country today. And frankly, for public health, this is our time, because though we have made enormous progress, we have doubled life expectancy through access to clean water and air. We've been able to address plagues by addressing vaccines. We've cut the rate of smoking in half, and more recently by giving people access to affordable preventive care. But it's just not enough, because after decades of progress, we are again beginning to lose the battle for the public's health. We see it manifest in the opioid epidemic, in chronic disease, in maternal mortality, and we have significant disparities by income, by the color of your skin, and by insurance status. And these challenges are now coming home to everyone. The CDC recently reported that the historical gain in longevity has not only plateaued, but is beginning to decline. And researchers have shown that when we map life expectancy in communities across the US, there's a dramatic difference in mortality based upon where you live, even a few miles apart. For my hometown of New Orleans, for example, that is 25-year difference, which, by the way, is the average age of your class. Now think about that. A person's zip code is a stronger determinant of health than her genetic code. And as Brene Brown has said, stories are just data with a soul. And for me, the soul of that data about the power of zip code, about the power of place, is in Austin, in the neighborhoods where I grew up. I was raised by a single mom, and most of the time we were barely scraping by. I went to a school that was chronically underfunded, with teachers who were overworked. And by the time I was in 5th grade, I would finish an entire day's worth of unchallenging work for me and be sent down the hall to tutor the 2nd grade. But in the summer before 6th grade, my mom found a way to rent a school just 6 miles, rent a house, just 6 miles across town. And suddenly everything was different. The neighborhood was safe, there was more green space, there were better after-school programs, the coursework was more challenging, and all of my new friends were planning to go to college, not just dreaming about it like I had been. Last year, I had the chance to meet Dr. Raj Chetty, who's the head of a team of researchers who's done quite a bit of this work to show that zip code is an important determinant of your health. And When I told him my story of growing up in poverty, he jumped up from the table and went to his computer to start pulling up some graphs and data. I don't know what he was doing. And essentially what he was trying to convey to me, that my story was part of his data. I was essentially a data point, my zip code, but also this fact that at just the right point in my life, I had been moved, which caused the trajectory of my life to change. My zip code was quantifiably the difference between a life of struggle and me standing on this stage today. I'm so grateful to my mom for the sacrifices she made to get me to a better zip code, but we cannot move every kid to a better zip code. That's why we must address the full range of factors that influence health and well-being beyond access to health care. Education, safe environments, housing, transportation, educational opportunity, economic development, access to healthy food, these social determinants of health, or what I just now call life, all matter to be building blocks for a life that allows us to live and thrive and age with dignity. This is a big and broad challenge to think about making every zip code healthy, I know, but it will not be solved by one sector alone. And although public health has a major role to play, we will need partners. It must be what we do together to create the conditions in which everyone can be healthy. Public health is going to need to evolve to be a stronger and better partner for the work ahead. In fact, we must transform public health itself. You must transform it. There have always been moments in history when a generation has been called to do more. In the 20th century, we took medicine out of the hands of charlatans and put it into the hands of scientists. We eradicated plagues with vaccines. We made it so that comprehensive public health protection was possible for everyone. And in the second half of the 20th century, we failed to address growing threats like HIV/AIDS, which caused us to reflect inwards. And the institution of medicine said that we had allowed our public health system to fall into disarray, and it was a clarion call to do better, and we stepped up. We pursued the performance standard that would professionalize public health agencies and began to focus more on the most vulnerable in our community, those without a voice. Which brings us to today, to a critical moment in time called Public Health 3.0, when we are asked to see the bigger picture, to go beyond the traditional public health functions, the traditional public health programs, to really require us to be leaders of what I like to call chief health strategists, to bridge the progress that we have made in the past with a vision of a better, more equitable, more just future for everyone, no matter your zip code. It brings sectors together to achieve something that none of us can do alone. It calls for all of us to do our part, just as we had to do after Hurricane Katrina. And I know that's why you're here today, to lead into a better future. Whether it's health policy or biostats, communications, epi, maternal child health, the many, many facets of public health, these things and many are much more than a job. We are healers, not of broken bones, but of broken communities. We want to find ways to make families sure that they can get the kids nutritional food so that they can make it through their school day, so that grandparents won't struggle to find a way to pay for their medications, and that little girls don't have to have the opportunity to move across town to have a better life. I'm here to tell you that you don't need a fancy title to embrace the role of a chief health strategist, no matter your position or your job. Remember that you all matter, and we cannot do this without you. We need the kind of strategic, inclusive, activated leadership now more than ever before from everyone. The kind of leadership you have learned here at the BU School of Public Health. We need you to strengthen our knowledge base with research that will help us bridge long-standing divides. We need you to invent systems and policies for our communities and the healthcare system that will deliver better outcomes for everyone. And we need you to build strategic partnerships that create collective impact. We need you to keep thinking and learning and teaching and, most importantly, doing. Barbara Kingsolver is an author whose work I admire, and she writes about what it's like to survive the kinds of zip codes that can determine your future. And so I want to end with a thought from her book, Animal Dreams. And she writes, "The very least you can do in your life is figure out what you hope for. And the most you can do is live inside that hope. Not admire it from a distance, but live in it right under its roof. We live in a time when there is much to hope for: new technology, new cures, the promise of justice and health for all. It's a truly transformational time, and we can and must revolutionize how we help the people who need it most. The potential to change lives is honestly endless and very exciting, but hoping for these things to come true, that's the very least we can do. Today represents an incredible accomplishment for you because the degree you're going to receive in just a few moments, because of the world-class education that you have had at this university, you are already ahead of so many who are on this journey to improve the public's health, and you have more power than you know. I ask you to live inside of your hope, to seize every opportunity you have as public health leaders, as chief health strategists, and frankly, as just members of your community, to create the conditions for a healthier, more equitable world. As someone who's had the opportunity to walk that path, I can tell you that the rewards are great. It's a life of joy and meaning and impact. So as you take your degree and leave this place, as you thank your loved ones and snap your selfies and celebrate, remember your very last assignment today. Go out and heal our communities as only you can. Live inside of your hope and use your power to change the world. Congratulations, class of 2018, and thank you.